السلام عليكم ورحمة الله وبركاته. صباح الخير جميعا. إدارة الشؤون الأكاديمية بصحة الطائف ترحب بالجميع بلقائنا المتجدد دائما. طبعا دورتنا اليوم حيكون بعنوان تطبيق لوائح وزارة الصحة لعيادات الاستشارة الدوائية خلال COVID-19. طبعا اللقاء بقيادة الصيدلانية الدكتورة رشا محمد الزهراني، هي متخصصة في علوم الصيدلانية والصيدلية السريرية وإدارة خدمات الرعاية الصحية، مدربة في عدة مجالات: تخطيط، تنظيم، إدارة خدمات وأنشطة الرعاية الصحية، مديرة قسم برامج الإقامة في الصيدلة السريرية، مديرة مشروع برنامج الإقامة الصيدلية في الصيدلية السريرية، ومشروع إعداد أدلة الإرشادية لعيادة الصيدلية السريرية المتخصصة. دكتور رشا، المايك معك، تفضلي واعملي شير سكرين. دكتور رشا.
السلام عليكم.
السلام ورحمة الله وبركاته.
طيب السلام عليكم جميعا. حبيت أرحب فيكم بمحاضرة اليوم إن شاء الله من تنسيق صحة الطائف. And I would like to thank all the organization and scientific committee of inviting me to present this lecture, and especially thank for Dr. Abdulrahman Suwaidi and Mr. Tariq Aziz. This lecture, it will be about the implementation of the MOH regulations in patient counseling clinic during the COVID-19. So we will take an overall about the objective. As you see here, we will make a review about the update of counseling clinic system and applying of MOH regulation in patient counseling, and we will explain some steps about the enhancing of counseling system, explain how we deal with the patient in this clinic, and we will explain some standard regarding this counseling clinic and how to improve our ability as a pharmacist, and how to establish and maintain this communication skills with the patient. So, and overall in history, I will talk about the history of this project, when we started and what we have until now. So the idea of this project, it's starting from 2016 as just an idea of patient medication counseling clinic project. After that, in 2017, this project was established by creating the first manual and training around 30 pharmacists about the scope of this service. So after that, we have a highly supported from the Assistant Deputy Ministry for Medical Support Service at MOH. And the actual launching for this project was in 2018. In 2019, we are established a clinical pharmacist, other kind from the general one. That one is become for specific population, and it's minor selected specialized from the specialities from the pharmacy field. In 2020, as you know, General Administration of Pharmaceutical Care here in MOH is preparing a guideline for clinical for clinics like diabetes mellitus and anticoagulation. After that, we are going with the COVID-19. That one make us to change our mind, or we should be thinking out the box, as usual say. So we converted this clinic to become a virtual clinic during this COVID-19. So as a description, we are establishing the clinic ground by pharmacists to ensure that the patient has been educated and counseling about how to use his or her medication safety and very effectively. Actually, in this department, we have two kind of clinics: patient counseling clinic and the other one specialized clinic. I will go to explain in each one and what is the difference between each one. So as you know, here we have a SIPAHي standard as a local standard. المركز السعودي لاعتماد المنشآت الصحية. SIPAHي urges the importance of providing counseling to patients which have been established as a basic standard by which to measure the performance of pharmaceutical service within the health facility. So how we establishing this policy, and how we and I will start with the first processing from these steps. So an overview of this policy, as you see here, it's this one that one for our policy in MOH. I will go through and summarize for mission, vision, and the goals from this policy. What's the working hour, who's the providers, the clients, and the processing. Last step, it will be talking about the documentation, how we can document it in the clinic, in the counseling clinic for each patient. So the mission of establish the clinic, ensuring that all the medication, treatment devices, and related pharmacy service reflect the intentions of the prescriber, and they are consistent with the quality of the optimal use, goals, and health value of the patient. And for the vision, it's the providing adequate information when dispensing medication to improve patient health outcome. So in our goals, as you see here, in counseling clinic, even rather than it's a general or specialized, our goals is related for the patient, physician, health services, and the pharmacist. The goals from the establishing this clinic or this service are to improve the patient adherence to his or her medication, improving the clinical outcome and the quality of life for each patient, and also improving the physician knowledge by reporting and giving feedback about the medication information. Also improving the skills and knowledge of the pharmacist who runs this clinic, as well as improving the hospital service. So what about the qualification? Who's the providing the this information for patient, and what about the skills and experience of this service? Should be for the who's responsible about this clinic, even general or specialized, have at least a bachelor degree from the College of the Pharmacist. About the specialized clinic, should be at least here the PGY1 or master degree from the clinical pharmacist, and absolutely if he have the PGY2 or PhD in specialized pharmacy field. And a qualified pharmacist with at least 3 years of experience, and it's preferred he has a training certification in patient counseling or in a specific area like diabetes educator patient or anticoagulation course. So what about the working hour? MOH policy regulates the working hours in clinical to be at least 2 days per week to cover at least 0.2% from the total OPD patients. So if there is if there is a shortage of staff or the clinical pharmacist is not have a fixed hour to work in this clinic, from my opinion, it should be beginning by gradually hours. If he is starting by 1 day per week, then after that, if the patient become a lot of patient or there is more staff for enjoying together in this clinic, can be increased these hours. So the appliance or the tools we are needed to operate this clinic. When we need to establish this clinic, we should prepare a good environment for this clinic, for the patient, for the pharmacist. The clinic should be located in a suitable area, independent clinic or a separated clinic in the ambulatory building with a privacy area. And the equipment should be available like a computer. If some patient have, if some hospital have his system is better, printer, desk, office, phone, and drug information source and a brochure, printed medical material and folder. And should we have a space for a sitting for a family members or a caregiver if somebody came with the patient inside the clinic. So the counseling clinic service will be provided to patient who's the target from this patient in our clinic. If the patient has any medical comorbidity like a diabetes, chronic disease, hypertension, this patient should have at least 1 appointment with this clinic. Then the follow-up depends on the case with the clinical pharmacist or the physician. Also, if the patient have polypharmacy, 5 medication or more than the multiple doses per day, and also who has a problem with managing medication related to the device, the devices, who has a prescription of the medication with narrowing therapeutic index, or the patient who need for therapeutic monitoring, and also who non-adherence to his or her medication. So, as you see here, the flow chart, this is a simplified system of the patient counseling service. We're starting from the prescribing at the physician clinic until the patient get the education about his medication. So I will get step by step in details. The prescription, this steps it will be in the physician clinic. So the physician should write all the full prescribed medication information in the script, which including diagnosis, age, allergy, name, doses. The prescribed should be full, and also if the patient matching the criteria for this clinic should be referral from the doctor, or can be transferred from the OPD pharmacy from the ambulatory pharmacy to this clinic. In dispensing step, the pharmacist will be review all prescribed medication to ensure that there are no any prescribing error or notes, and they send the prescription to the preparing and dispensing. If the patient meets the criteria, the pharmacist shall inform the patient to go to the patient counseling clinic. In section of reconciliation, this processing should we have a reconciliation form, as you see here. So this third step is conducted by pharmacists by gathering patient information, like a patient characteristics, symptoms, medication history, lifestyle history, medication related issue. After that should be filled by physician or pharmacist, but almost the time the pharmacist he will do this step. As you see here, the reconciliation report should be fill all the medication the patient who's taken from the dispensary, from the other clinic, from private hospital, from the other region, should be written all here. Also, if he's take OTC medication or complementary or herbal medication. After that, we will go through this column, this row, by just a checklist for each medication. If the patient he's not a frequent incorrect way, if the patient he know why he's take this medication. Sometimes we catch some duplications or some interaction between herbal material or herbal medication with the treatment, with the newest treatment plan. So instead of reviewing and management plan, the pharmacist will be review the diagnosis and comorbidity of this patient, and the pharmacist will review all medication, including the medication from the other clinics, as I mentioned before, doses, the route of administration, frequency, and possible side effect, laboratory result. If he is a clinical pharmacist, have authority to order that for diabetes clinic or for anticoagulation or smoking cessation, depend on the specialty of the clinical pharmacist in this clinic. And develop the medication counseling plan depend on all this information. So this is a checklist for counseling to help us to make a full counseling and answering the question for the patient. And as you see, it is just a checklist that we can use in making a comprehensive survey to fill in the gap that may be the cause of the patient treatment plan failure. Then we can solve this problem. In counseling and answering this question, also this is part related to the communication skills between the pharmacist and the patient. The pharmacist should be choosing appropriate service providing method, whether writing, verbal, or digital, according to patient requirements and the patient different cases and condition. If the patient have hearing loss, he has visual difficulty, or he is non-educated, or the patient have some issues with our language or with English language. So we should to consider this issue when we are provide the counseling for this patient. And should be use a simple language, non-medical language or jargon language. to reach the goal from this clinic and to give the adequate counseling for this patient. And also we should taking into the consideration eye communication with the patient for interested and for the beneficiary, and use effective communication such as the body language or non-verbal communications. So we should also not should, but I prefer if you can use it a cautionary or the advisory label if available in your hospital. So in the last of the policy, we will find many forms. It's starting from the patient counseling form, checklist form of this patient counseling reconciliation report. The three first forms, it should be available and print out for each patient, and we should document everything we are catch it or we are fill it in this form for each patient. Should be have a file in each clinic. If the patient catch any drug quality reporting or any adverse drug reaction reporting, should be report this one at Saudi FDA online. There is a special form, electronic form, we can fill it. And when the patient transfer or referral for our patient, for our clinic, I mean, we can use the coding referral form is available in each hospital regarding MOH policy. So medication error reporting also we can do it through the MOH link. So this part we are talking, we are finished establishing the policy. What about the training? When we are the project planning, this is the process of project planning, counseling clinic planning. The training in our MOH, we are trained more than the 70 pharmacists about how to establishing and running the clinical according to MOH policy. The general administration pharmaceutical care are coordinate work online train courses in cooperating with the association and the university to provide the best training courses for pharmacists, especially in COVID-19. So encouraging the pharmacists to start these services. As you see here, this is our kingdom. In each region, there is specific number from the clinical pharmacist, and also we have a KPI for each region. Now this number, because the COVID-19, as you know, this number, it will become changed. I will explain in last lecture how we can solve this problem. So after this step, we are tracking the number of clinics, and the patient number we are collecting the numbers of the for each clinic in each region. As you see here, in the number of clinics and patient in counseling clinic in 2018-19, it's become from the last quarter of 2018 until 19, it will become decreases. And also, as you see here, the numbers of the patient around it exceeds the number 28,220 patients have been counseled through these clinics. And also there is a specialized clinic. The numbers of this clinic around 5 clinics until now, but still we are trying to dissolve this issue with during the COVID-19. As you see here in 19 numbers of the in 2019-2020 during this during starting the COVID-19, the number of the patient was decreased dramatically. So to dissolve this issue and continue to keep going to improving the hospital service, we found another system to provide the counseling service by the converted this the actual clinic to the virtual clinics. So the virtual clinics are used the ANAT platform. The ANAT platform aims to provide the channels of the communication between the health participant and beside the presenting services that facilitate their work and raise the level of the health service offered to patient. The aims come on the health practitioners. Registration should be registered before the sign in to this platform. And this platform help us to write the electronic prescription, and we can view the 2020 medical events. And also in the last thing, the electronic cancellation by video or audio calls. So this is the ANAT platform. After converted the clinic to the virtual clinics, number of the patient, it will be started to increase from the 51 in the end of 19 up to 1,606 patient until now. And we are reach about 15 virtual clinics dispensing in each region of the kingdom. After these steps, we are looking about how we can enhancing the quality. So in 2019, we are working to improve the quality of this project by trying to measure the outcome by measuring the satisfaction of patient of cancellation clinics clients. And we are working in other project with Dr. Ahmed Saleh about the satisfaction of the patient. Applying of medication patient counseling clinic policy. As I mentioned, the purpose of MOH policy is to guide the pharmacist department during the establishment of the clinic, but some modifications should be considered during this implementation and during the establishing this clinic, depending on the situation of each hospital or culture. An example, if we have this hospital for adult, if we have adult patient, criteria cannot be applied to pediatric hospital, and the hospital in this case should look at its own patient's needs and then determine the patient criteria. So sometimes we have a challenge in each project, but I will mention some of these challenges. It's from Imam Hospital with Dr. Ala Matlaq. So the challenges is sometimes there is no patient. We're referring from the physician clinic. There is no patient referring from the physician, also from the OPD pharmacy. No patient matching our criteria. And also sometimes we have the not suitable location for this clinic, or the hard copy documentation is take more time from us. So we need other solution to modification this policy. So we can make a redesign for this problems, like if the location of the clinic is far away from the patient, we can change it, and we can call the medical director to arrange our clinic with the patients. So if the patient have other criteria, and as you mentioned before, if I are working in the patient in pediatric hospital, should be our criteria matching to the pedia problems, not the adult problems. Also, we are looking for a provider. If we have a shortage of staff, we can make other modification, like if the patient have, if the pharmacist, can we work with the part-time with the clinical pharmacist, and the other part-time with the OPD pharmacist, or even ER or satellite, depend in each hospital. Also, we can make a simple modification with the processing. If there is other processing for referral or follow-up, especially in the specialized clinic, we can make a simple processing that serve our patient in this clinic. Also, the documentation, if some pharmacists have any idea or have any way to make a better documentation for him, he can make a modification for him policy in this clinic. So, in summarize, there is 10 behaviors of effective counselor. In this slide, I will show you some of these from this behavior. If the patient came in our clinic, so what we should have the pharmacist doing with this patient. And overall, the pharmacist should introduce themselves briefly, not in the long way. So, and friendly greeting to make the patient feel comfortable with him. And after that, the patient can ask questions for their medications, therapies, and health conditions. The second one is the communication verbal. The pharmacist can encourage discussion by asking a question for the patient. And he can also assist the patient from the answer of the patient, and already he can know what is his knowledge, he's educated or not. He can catch something from the verbal communications. Also, there is non-verbal communication. That one is depending on the on body language or in the voice tone. When pharmacists talk with the patient, he can also should be maintains the eye contact with the patient, demonstrate an interest in this in the information, the non-verbal causes like facial expression or the tone of the voice. So listening or listen, it's very important for the patient. The pharmacist should be make very active listening with the patient. So when we counseling the patient about the medication therapy, the listening to the concerns, questions, and need of the patient is essential. Also, the pharmacist should be asked questions when posing the question to the patient, pharmacist also should start the reasonable question, not just for a questioning. Should be make a smart question, open-ended question, to collect more information about this patient and how he's get this how he's get this medication. So also we should remain the clinically objective. It's important for pharmacists not to allow the personal beliefs of this of our either ethically or regionally religious to affect their ability to counsel the patient effectively. Pharmacists should make every possible effort to be non-judgment and impartial, to focus on the patient care and to maintain the professional behavior. Also, the pharmacist should show empathy and encouragement for this patient, and to feel the patient to feel comfortable when discussed with the pharmacist, counselor pharmacist. And during this consultation, the pharmacist also should remain the patients to call the pharmacy or their physician with any concerns about their medication. Number 8, provide privacy and confidentially to ensure complete privacy and confidentially helps to enable patient to feel comfortable discussing personal medical issue. Number 9, counseling to meet the patient needs. The ability to tailor the patient counseling to meet individual each patient needs is critical. Pharmacists should be aware of patients with disabilities and be prepared to treat them with respect and understanding. Also, such as the inhaler or injectable medication, the pharmacist should demonstrate the proper technique to ensure the patient are adequately trained. And last step, motivation of the motivate the patient. Effective counseling not only provide the patient with the appropriate information they need to use their medication correctly, no, but it also to motivate them to adhere to their medication regimen, and pharmacists should look continuously for a way to inspire the patient to learn more about their treatment plan. So in summary, we are locating the right position of the clinical and suitable equipment, drug reference. We are focusing on the location of pharmacy for clinical counseling clinic. It's very important, the location of this clinic. And also determine the patient criteria or a specific clinic. Improving your skills and knowledge should be the pharmacist keeping updating, and he should read more about the latest updating management in each field. He's provide the counseling clinic. And also advertising the clinic services and impact for physician and patient. electrochemically documenting the patient information, recommendation, and interventions. The pharmacist at least should be analyzed this data and looking, and he can read what he's have in this clinic, reporting your comment to physician, pharmacist, and your leader, acting if needed to improve the patient care and hospital system, and also should be maintenance the continuously to get the best to reach the goals of this project, and also to get the best education for the patient. This is my lecture. I hope to get helpful from my lecture, and thank you all for attention.
Thank you very much, Dr. Informative lecture. Thank you very much. If you have any questions, please go to Q&A and type your questions there, please. الله يعطيك العافية دكتورة. إذا في أي سؤال يخص الموضوع يا ريت لو تتوجهوا لخانة Q&A عشان تكتبوا أسئلتكم هناك، وإن شاء الله الدكتورة بيجاوب عليها بإذن الله الرحمن. انتظر أسئلتكم في خانة Q&A يخص الموضوع. طيب الظاهر انه وصلنا.
ما في اسئله.
طيب الاستاذ عبد العزيز ابراهيم الزبيدي يقول شكرا جهودكم، بارك الله، شكرا لكم انتم.
يعطيك العافيه، يعطيك حضوركم.
بارك الله فيكم.
بارك الله فيكم، شكرا
طيب.
لك دكتور.
الله يبارك فيك. هذه شهاده شكر مقدمه من اداره الشؤون الاكاديميه وتدريب صحه الطائف. الله يعطيك الصحه والعافيه.
يعطيكم العافيه، شكرا جزيلا.
إن شاء الله نلتقي إن شاء الله في محاضرات مستقبلية في إدارة الشؤون الأكاديمية والتدريب إن شاء الله. بارك الله فيك.
إن شاء الله، شكرا لك، شكرا لحضوركم.
الله يبارك فيك. طبعا بكرة البرنامج العلمي القادم إن شاء الله، بكرة عندنا ضيف من مصر العزيزة، حنبث إن شاء الله من مصر بكرة. هيكون معنا الدكتور محمد موسى سعيد، هو أخصائي أمراض نفسية وعلاج إدمان بمستشفى الخانقة، مدير طبي لدار المعادي للصحة النفسية، مؤلف لرواية الخراب، ومؤلف لمجموعة قصصية رسائل بين ضفتي الطريق. طبعا حيتكلم الدكتور عن الاكتئاب من منطلق علم النفس والاكتئاب البيولوجي. خلاص طبعا حيكون دورتنا بكرة من الساعة 7:30 مساء حتى الساعة 9 مساء. حيكون عن طريق المنصة التدريبية منصة إرادة، وكذلك حيكون عن طريق منصة زوم، وكذلك عن طريق البث المباشر اليوتيوب للعامة إن شاء الله بإذن الرحمن. بالنسبة لشهادات الحضور اليوم إن شاء الله زي ما أنتم يعني معظمكم عارف، الناس اللي بيحضروا معنا دائما نسبة الحضور لازم تكون 85% عشان تصدر شهادة للعامة. أما بالنسبة لزملائنا من منصة إرادة لازم يتوجهوا إلى منصة إرادة بعد انتهاء البث ب 35 دقيقة، يروحوا لقائمة شهاداتي حيلاقوا شهاداتهم موجودة هناك. بالنسبة كيف حنحسب ال 85%، نحن شركة زوم تتيح لنا كل شخص فيكم قد إيه حضر، بنحسب 85%. طبعا الدكتورة اليوم بثت تقريبا ساعة، حنتكلم عن 51 دقيقة. لازم الحضور يكون أكثر من 51 دقيقة عشان نصدر الشهادة. زي ما قلنا لزملائنا من زملائنا في الصحة وصحة الطائف توجهوا لإرادة، وإذا عندهم أي مشاكل بيواجهوها يا ريت توجهوا للدعم الفني، هنا الخانة اللي حتلاقوا فيها شهاداتكم. اللي إذا عندكم أي استفسارات أو اقتراحات يا ريت لو تكبشروا الباركود اللي قدامكم، تتواصلوا معنا، عندكم اقتراحات، استفسارات، أي حاجة أنتم تبغوها إن شاء الله حنرد عليكم. بالنسبة لزملائنا منصة إرادة يا ريت لو تتوجهوا للدعم الفني إذا بتواجهوا أي مشكلة في الموقع. جميع دوراتنا اللي راحت وكمان إن شاء الله المستقبلية كلها مسجلة، وحتى الدورة هذه مسجلة في منصة إرادة وكذلك بقناتنا اليوتيوب العامة. الله يعطيكم الصحة والعافية. جميع دوراتنا وإعلاناتنا بتنزل في صفحتنا في تويتر، طائف تريننج 1 خلاص. فاللي عنده برضه اي استفسار او اي حاجه ممكن يراسلنا هناك. بس حاليا عندنا مشكله مع صفحاتنا في تويتر، قفلوا لنا هي تويتر قبل فتره عشان فيريفيكيشن وحاجه زي كده واوثنتيكيشن. باذن الرحمن نلتقيكم ان شاء الله في دوره الغد باذن الرحمن. والله يعطيك العافيه دكتوره، وشكرا لك مره اخرى. في امان الله.
الله يعافيك، حياكم الله. هلا دكتور.
مع السلامه.